I'm a vet, and obviously I work in the rural environment, hence wanting to talk to you about this as a possible career opportunity for you. I guess lots of people get put off by veterinary because I hear this all the time from schools. Oh, it's really difficult to get into, and you have to get amazing grades and all that kind of stuff. And I admit that getting into vet school can prove quite tricky. You do have to have quite a lot of practical experience, so get yourselves out on farms, get references from farmers, ideally also from people who own stables, dogs and cat kennels, catteries, all that sort of stuff. Which will be very, very helpful. And there is a new course which not everybody is aware of just now, being run up in Aberdeen. And this is designed to encourage rural vets because there's a big shortage, especially in Scotland and in the Western Isles, of veterinary types who want to do out and about rural stuff and not be, doing cats and dogs. And for that purpose, they have designed this new vet school up in Aberdeen, which I'm giving a huge plug to, who have lower entrance requirements. So even if you're not a straight A student, you should still not write off the possibility of being a vet because it is now available to a slightly wider audience, especially if you come from a farming background or have got lots of experience in farm animals. Because me sitting here talking at you is probably going to be a bit boring, I thought I would include some cases just for interest. One of the things that we have to do as vets all the time is deal with a huge variety. And one of the reasons why I still like my job is dealing with such a large variety of jobs on a daily basis. I have to give you a warning before I start this little presentation of some cases that there is some blood and guts and gore in this. So if you don't like any of that, it's probably best you go and make a cup of tea. So I'm going to go and share my screen. Hopefully there'll be a slight delay. Bear with us. And then hopefully it will turn on. Okay, so hopefully you can now see this screen. Not yet. Is the screen yet? It says I'm sharing.
That should be it now.
It's there now. Okay, excellent. So in my day-to-day life, I am a horse vet, which means I qualified as a general vet and did all the stuff that all vets have to do. So I qualified being able to do cats, dogs, llamas, alpacas, cattle, sheep, the whole lot. But I then subsequently went on to specialise and did a whole bunch of extra qualifications, which are not necessary, but I wanted to do them. And that gave me a specialist qualification. And I do certain things like this one, which is scanning a horse's heart to see what's going on. And in this, not this case, but in other heart cases, we do some funky stuff that we're able to do these days. And this is a little video from a horse who had, I'll give you a little explanation before you show the video, but it's a horse who is under general anaesthetic in a knockdown box, which is like a rubber padded cell essentially. And its heart was in a funny rhythm. And so what we did was we put a whole bunch of electrodes into the inside of its heart, which then went in through a blood vessel. And then we put a shock wave through the heart to try and basically stop it and then start it again so that you get it back into a normal rhythm. And this is what they do in humans actually, but we had to modify how things were done in a horse because obviously the cables and the amount of electricity required to stop a horse's heart is dramatically more than it is in a human. So this is a little video of us doing this in Bristol University where I used to work. So we're just waiting till its heart's looking good and shock coming on when he presses the button. Has an electric shock. And then that's an ECG we're looking at and its heart's gone back into normal rhythm. So you can get to do some really cool, funky stuff. One of the other things that we do relatively regularly is use our ultrasound to see what's going on in a horse's chest. So this is me looking at a horse's chest with ultrasound. It doesn't hurt. It's just a probe which goes over the surface of their chest. And I'm looking at this bright white line here on the screen, which is showing me the surface of their the lungs and to make sure the surface looks okay. And this is a common thing that we do in trying to figure out what's going on in horses' chests. This is the same horse, and it doesn't look that great, but what I'm doing is not torturing the horse, but we have these difficulties with animals that we don't have with humans. So if I want to listen to a horse's chest, I need the horse to take a deep breath. If I was a doctor, I would say, please sit still and take a deep breath so I can listen to your chest. But unfortunately, horses won't do that up to command. So what we do is we put a bag over their nose. It's called a rebreathing exam. And you get them to breathe in the air they just breathed out. And over time, they use up the oxygen in there. So they start to breathe a bit more heavily. And then when you take the bag off their nose, they will take a great big deep breath in, and it lets me have a really good listen to what's happening in their chest. So when we're dealing with animals, we are endlessly having to try and figure out novel ways of getting them to do what it is that we need them to do, without hopefully upsetting them too much. And the other thing I'll just point out at this stage is when we're looking at horses' chests and dealing with horses with diseases, a lot of people who get into doing veterinary think that they're doing this. Usually they're doing it because they love the animals, they love working outside, which is why I did it. And there's a bit of a misconception that it's all about working with the animals, and obviously it is. But there are people on the end of the horse or the cow or the sheep. There's farmers to deal with, the horse owners, dog owners, cat owners. And so actually it's much more of a people job than you might think. So if you really, really don't like dealing with people, it's probably not the job for you. And this is another way, this is a weird picture, but this is a video of a video. So this is the screen that is attached to a camera that we use to look down in a horse's airway. So this is the trachea, this is the windpipe. This is a horse that was really struggling to breathe. Now that should be a big open circular channel. And as you can see, it's very, very narrowed. And this was a disease process that's not uncommon actually in little Shetland ponies. And in this case, we had to try and do something to make this more of a round circle so they could breathe a bit more easily. But this is another way that we might investigate a horse's ability to breathe. Another thing that I've been involved in for quite a few years is the animal rescue side of things. So unfortunately, lorries and horses' trailers go over on roads now and again. And I've been involved in the training of vets and how to deal with these situations. They are always very exciting, stroke terrifying when you're dealing with them. But in this case, this was a really lovely example of a horse who, poor thing, the trailer had gone over several times on a motorway. So it had done a full 360 twice. And the horse was now putting its feet through the side of the trailer because, of course, it was on its side. Anyway, after all of that, and after a wonderful fire brigade got in there and chopped out various bits of metal inside the trailer and propped up the bottom so that there's something solid for it to walk on, it did, in fact, walk away and came into our hospital at Bristol and was largely unharmed. We were quite surprised, but this is one of the jobs that I do relatively regularly, and it is actually always quite rewarding when you can get them out safely. And there's various other pictures of horses in various situations that they've got themselves in trailers, partly once or twice because they've got a fright, so they've tried to jump over central partitions, and other times because the trailer has stopped suddenly and they've got a fright and ended up in a funny position. But all of these jobs are another aspect of what it's like to work as a vet. Now, gory picture next. So shut your eyes if you don't like blood. You do have to be a little bit okay with blood when you're working as a vet because it's not uncommon to have a bit of blood and gore. But it is also quite rewarding when you can patch them all back up again. I realise that I'm running on in time a little bit, and these ones are other cases that I've dealt with. This is one that had neurological disease. So one half of its face is working quite happily. The left-hand side, as you look at it, or its right-hand side, is perfectly normal, but its left-hand side has lost a lot of its muscle ability to move. So its ears floppy. It's not really moving that. This muzzle is pulled to the one side, and what you will see here is that it's not really blinking. And I think that over the space of my talking from the start of this slide, you will have blinked several times by now. Well, this horse isn't blinking at all, and that's because the motor control to that eyelid has gone. So we do deal with neurological cases as well. And I've got a picture of another neurological case. This actually was in America when I was over there studying, but they get a bunch of interesting neurological diseases, and we get some of the similar ones here where the horses lose control of their back end. So they look fairly healthy and they're moving about relatively well until they have to manage obstacles, and then their back legs just don't work very well. So this is what's called an ataxic horse. In other words, its brain doesn't know where its back legs are in space. So these are also quite interesting clinical conundrums for us to try and figure out. I'll skip on now a little bit. One of the other things we have to deal with in the whole blood and guts is an ascarid impaction. So these are worms which young horses get, and they can get so many worms that it actually blocks their intestine. And that's a big surgery that's required. But it does sort of emphasize the importance of worming. Another job we sometimes do is blood transfusions, and actually often plasma transfusions. So here is Minstrel. He's a good friend of mine, this boy. He is from World Horse Welfare originally. He came in with a very sad story. He was very skinny, and then he very quickly got quite fat because he's quite a foodie. And he was an amazingly good blood donor because he's just the nicest horse in the world, and would stand still very happily in order for me to take several litres of blood off him, quite a lot. And at some point, hopefully, he will turn his head and you can see his neck there. So as you can see here, I've got a catheter which is going into his vein. There's a tube coming out, and we're getting this blood here, which was actually to try and rescue one of the friends of his that came in from the rescue place at the same time, who was very, very sick. And again, this is sort of emphasizes the fact that you can't really be too squeamish with the whole blood thing, because it is unfortunately one of our daily things we have to deal with. Another bit of blood and guts for you. I know some people like a bit of gore, some people don't. Personally, I'm a big fan of this because it's just like popping a great big spot. So this is a horse that had an abscess on its bottom. And as you can see, that's me getting rid of the abscess, and there was plenty of it. So again, you really don't want to be dealing with that if you're squeamish. And the smell was quite overwhelming. You can even see the steam coming off it. So these kind of jobs are the things that, you know, people like me absolutely love dealing with, but it's probably not for you if you don't like a bit of blood and gore. And next, I have a picture of a friend of mine called Claudia. She works at Edinburgh Vet School nowadays, and she's had a very varied career. She started her life as a cattle vet, so she decided she was going to be doing cows, dealing with farmers, having a great time, cups of tea out in the farm, doing cesareans in the middle of the night. And then sometime into it decided to change her path completely and specialise in eyes. So that's what she now does. She's a specialist ophthalmologist at Veterinary One. She works in the university, but she gets to do a bunch of cool stuff, including looking at this tiger, which was for London Zoo when we both worked down in that part of the world. And this is another picture. One of the things we have to do relatively commonly is have a little look and see. This here is a little melanoma. We thought it was a melanoma, which is a tumour in a horse's eye. But then with ultrasound, we scanned it and realised it wasn't solid. It was just a cyst. So that's all good. And then last of all, I know I am running out of time. I just wanted to show you a little video of how to anaesthetise a horse, because people quite often ask me how you get a horse to lie down, because when we're dealing with cats and dogs and we want to, for example, remove a lump, we have to get them under general anaesthetic. But with a cat or dog, you can get them to sit down first, and then give them a little bit of a a sedative so that they're all nice and calm. And then we'll use drugs, specific drugs we use to give them to get them to go to sleep and be under anaesthetic. In horses, of course, I can't just ask them to lie down nicely. So I thought we'd video how we do it. So this is a padded floor that they're standing on, and that crushed door with several people pushing it is also padded, and the horse is against a padded wall. And the idea is, of course, that we don't want the horse to hurt itself. So the drugs that have been given are now kicking in, and it's feeling a bit wobbly. Hopefully in any minute now, it will start to slide down that door. And this is a controlled way of it lying down and not hurting itself, and importantly, not hurting lots of other people, because they're big animals, these things, and if they flop to the side and hit somebody, then of course they could do a bit of damage. And so then the next picture is the horse that's on the ground, and here you can see we've got a tube going down its windpipe so that we can make sure it's getting enough oxygen when it gets hooked up to the machine. And of course, the other problem is with a 500 and something kilo horse, you can't just pick it up and put it on the theatre table. So we have to use this winch. This is in Bristol University, and that winch is particularly slow. But we used to pick them up, winch them along, and then get them all positioned onto a table, which is in the next picture here. So now we've got the horse on the table, and it's been wheeled into its theatre position where it's going to get surgery on its leg. So I think I've overrun a little bit, so I'll shut up now, and I'll stop sharing and see if anybody wants to. How do I do this? Stop sharing. See if anybody has any questions.
Hello, Anna. Thanks for that. That was very visual. I very much enjoyed it. We do have a question in for you from a 4th year class. They want to know, apart from volunteering, what is the best way to make them stand out when applying for uni for going into these types of courses?
Actually, the more volunteering, the better. So the thing that will absolutely make your CV stand out is by having a wide range of volunteering on it, as much as you can. So as many farms as you can, and also, like I said before, the catteries, the kennels, all that sort of stuff. You can also, sometimes you can go into your local vets and just help out, or, help out moving animals around, cleaning out kennels. I mean, you'll get very menial jobs to start with, but the good thing is that if you keep going back, they'll start to trust you and you'll get to do more interesting stuff. So going to your local vets practice as well, and having as much of that on your CV as you can before you apply is a huge advantage.
Fabulous. And having watched your video there, just curious, I'm sure most people are, do you have to be quite physically fit then to work in veterinary?
That's a good question. I guess for the large animal side of things, yes, I think you probably do. In order to work with cattle and with the horses, the big things, for moving them around and getting out of the way quickly when you need to be, I think you probably do need to be pretty physically fit. I would say less so for doing cats and dogs. You could probably get away with moving less. But it is still quite an active job. And I think for me, that was a really important part of the fun of it. So I didn't want to ever do a desk job. I never wanted to be in an office. And so being out in the rural environment and doing horses for me is perfect. But, if you wanted a desk job, then it's probably not for you.